I think this is one of the big things that are prescribed to women for all types of concerns: acne,
Absolutely.
irregular periods, heavy periods, like just the list goes on. So I wanted to jump into just defining what the birth control is and the different types.
Yeah, so birth control is a way of controlling birth and pregnancy. And so if it's being used for anything outside of that, I would say, consider other options. So birth control, the way it works is you have these synthetic hormones that go in and they stop your ovulation. So without ovulation, you don't get a period. Ovulation is kind of that event that really sparks everything else that's happening around your cycles. So we don't have that natural rise of FSH and LH. We don't get that estrogen peak and that progesterone peak. Like none of those things happen. When you're on birth control, you have a steady flow of estradiol and progestins to prevent ovulation and to prevent pregnancy. And as a woman, everything our body does kind of centers around ovulation. So if you're having irregular periods, if you're having absent periods, that may all be due to ovulation. Either you're not ovulating on time or something's going wrong with ovulation. You might be too stressed and you're not ovulating. Birth control isn't naturally giving you a period. It is just preventing you from getting pregnant. There's tons of different types. We have the IUD, we have the hormonal contraceptive pills, we have patches, we have shots, we have many different types of pills. There's the combination pill, there's the mini pill. So there's a ton of different options for preventing pregnancy. Most of them are hormonal. I think the only one that we have currently that's not hormonal is going to be the copper IUD.
Yeah, and I think the big key is that we're usually having kind of like an ebb and flow. It's this beautiful cycle of hormones going up and down throughout, and we don't get that on the birth control pill because you're getting a steady amount of hormones, which is then shutting off your natural body's ability to produce the hormones.
Yep, exactly.
So talking about those two synthetic hormones, can you just maybe touch on how they differ to our regular natural hormones?
When birth control first started, it was progestin only. That was the only option that we had. The reason that estradiol got added in was because so many people had such bad side effects from just the progestins. So they added in the estradiol component to kind of help mitigate those side effects a little bit. So progestins are kind of the main player in hormonal birth control. And what they are is they're similar to our progesterone, but they are not the same in that they don't have all the benefits that our natural progesterone does, but they do similar things in that they are changing your cervical mucus to prevent sperm from kind of sticking around. They are preventing ovulation, all of those things. But our natural progesterone also has lots of calming effects. It works on the GABA receptors to help with sleep at night in the second half of our cycle. It helps with our skin, our overall mood. There's so many benefits to progesterone that we're just kind of stopping when we throw in birth control. Natural hormones are there for a reason, and they're really doing a lot more for us than just preventing pregnancy.
What is the reason that they're actually seeing relief from a pill that is not necessarily doing what they expect?
Right. So the reason that your acne might clear up or your PMS symptoms might go away is because there's something underlying going on with your hormones. If you're having acne, it may be that you have too much androgens. It might be an issue with low progesterone. It might be a gut health issue that's unrelated to your hormones entirely. So there's a ton of different factors that are causing the symptoms that you're having. And so when you take birth control, it's just shutting your hormones completely. If you have excess androgens, if you have too much estrogen, if you have too little progesterone, it doesn't matter because those are all shut down. You can't have hormonal problems when you don't have hormones. But if you want to just cover up symptoms for a while, you're just like, I'm tired of dealing with this. I just want a pill to take away the symptoms. I don't really care what it's doing to my body. I don't really care what the underlying cause is. I just want symptomatic relief. Then great, that's your choice. I'm never going to tell somebody that birth control is not something you should opt for. I just want people to be clear of their options. So I would present all of her options. The majority of what I see, some people can have what's called post-birth control syndrome, where you either just don't get a period after coming off of birth control, or your symptoms just got a lot worse in terms of acne, PMS, pain. If you're trying to conceive and you had hormonal issues prior to getting on birth control, and then you get off of birth control, that time you were on birth control, you weren't addressing any of those underlying issues, and things just kept getting worse and kind of brewing under the surface. It all comes kind of flooding out. That is also something that can happen. I see a lot of women struggle with their hormonal issues because they were like, oh, well, I don't know, I had hormonal issues when I was like 13, 14. I was put on birth control. Now I'm 30 and I want to get pregnant. But for like 15 years, you've been taking birth control, and there's been maybe gut health issues, there's been stress issues, there's been issues with your thyroid that were just kind of swept under the rug and we didn't see it for almost decades. And now all of those issues have just gotten worse. And those are kind of the main ones, really, is if you had an underlying issue before, you may have another underlying issue. It may have gotten worse, or there may be something more that happens when you get off of it.
Yeah, I think that's huge because women are getting their periods earlier and earlier, and they're getting offered the pill earlier and earlier, then that's going to lead to, let's say, 10 years of just covered up symptoms that are piling on. And with a lot of these hormonal concerns, there are things these women can do. There are options. I have PCOS, and I think back when I was offered the birth control pill, if I took it, then all these years that I've had to really discover, oh, this is the type of PCOS I have. These are the hormones that are imbalanced. These are the things that I can do to take control of my health. If I didn't do that, what would my hormones have looked like now?
Exactly.